and very warm welcome. Welcome to our final lecture of the day. Thank you for your participation and commitment to advancing our knowledge in oral medicine. Firstly, I would like to thank Dr. Seema for this opportunity. Let's make this session informative and engaging. Okay. So let's start with the quote: technology, like art, a soaring exercise of the human imagination. As a radiologist, I have always been intrigued by shadows. When I came across this stunning shadow of Ganesha on the wall, I envisioned a beautiful Ganesha statue, casting such a captivating shadow. However, to my surprise, although there was a shadow, it wasn't a real statue, but something that merely resembled one. It turned out to be a stationary arrangement crafted by this gentleman to mimic the Ganesha statue. The lesson here is that appearances can be deceptive, and it's challenging to discern the true nature of something just by its shadow. Similarly, when we are discussing 2D imaging or 2D radiology, what I would like to call again shadowlogy, the shadows we observe can just be as deceptive. Sorry, I'm so sorry. Shadows we observe can be just as deceptive as we saw it in the previous example. If two structures are close together, if we see these images, they may appear as one single shadow. Additionally, there are factors such as superimpositions, distortion, magnification, and foreshadowing that can further complicate the interpretations when we talk about 2D imaging. Thus, 2D imaging is much like the famous story where blind men describe only a part of an elephant and mistake it for the whole. It provides incomplete picture and requires further analysis. So CT or computed tomography enhances traditional radiography by combining multiple 2D X-ray images. CT can be regarded as a third eye, offering a more complete and detailed view by transforming 2D X-ray images into 3D perspective and revealing layers that traditional radiography might miss. With this context in mind, I would like to begin my lecture today on the role of CT in maxillofacial pathologies. I'm Dr. Priyanka. Dr. Seema had already introduced me. I am a specialist oral medicine and radiology, and I'm having my dedicated exclusive oral medicine clinic at Nasik, and I have got experiences from academic and other experiences from India and the UK. CT applications in maxillofacial imaging is a broad topic that encompasses extensive details, including the underlying physics. Today, I will aim to provide concise overview, focusing primarily on the practical clinical aspects that are more relevant to oral medicine. I will be covering introduction to basics, CT techniques in maxillofacial imaging, clinical applications of CT, and indication, contraindication, and future trends. Coming to introduction of CT. So by definition, computed tomography is an imaging technique that uses X-rays to create detailed cross-sectional image of the body. It combines multiple X-ray images taken from different angles. So there are multiple 2D X-ray sources where images are generated and 3D image is reconstructed. It is essential for diagnosing and evaluating wide range of medical conditions. So CT has definitely made a significant advancement in the field of radiology. So how does this CT scan work? I would like to play a small video about this.
CT scan is an X-ray procedure that creates cross-sectional images with the help of computer processing.
I hope you can hear the voice.
CT images are more detailed than X-ray images and can reveal bones as well as soft tissue and organs. A conventional X-ray uses a fixed tube that sends X-rays in only one direction, while a CT scanner uses a motorized X-ray source that shoots narrow beams of X-rays as it rotates around the patient. There are special digital X-ray detectors located directly opposite the X-ray source. As the X-ray passes through the patient, they are picked up by the detectors and transmitted to a computer. Image slices can either be displayed individually in two-dimensional form or stacked together to generate a three-dimensional image that can reveal abnormal structures or help the physician plan and monitor treatments.
So there is a gantry where X-ray tube and detectors are located inside the gantry, and it rotates to take the images. This is the patient table. Patient is placed over it on this table, and then there is an operating console where everything is operated. It is very similar to our 2D X-ray where there is X-ray tube, there are detectors, but it is done very fast and multiple images are taken within the fractions of seconds. So talking about types of CT, axial CT is the traditional slice by slice imaging. It is not used anymore. Then came helical CT, and now recently, which is most commonly used these days, is multi-slice CT, where multiple slices per rotation are generated for the detailed image analysis. Advantages I will be explaining in the next slide. Now coming to cone beam CT, it is the specialized for dental and maxillofacial imaging. For dental applications, we generally use CBCT, but CT has added additional advantages that we will be discussing in detail in today's lecture. Development of CT technology. This slide illustrates the evaluation of CT technology from early 1970s to today. Early CT scanner used a single slice technique shown on the left, and the advancements had led to the multi-slice CT, that is MSCT, using multiple detectors for more detailed imaging. These innovations, including cone beam CT, has significantly enhanced diagnostic precision and broadened clinical application. The shift from single to multi-slice system improved efficiency and image quality, revolutionizing modern radiology. Now we talk about how CT image is reconstructed. Now, in simple terms, image reconstruction in CT refers to how raw data from X-ray scans is turned into clear images that radiologists can interpret and come to the diagnosis. CT image reconstruction relies on two main algorithms. The first is filtered back projection and iterative reconstruction. The first step is the filter back projection, where it takes raw X-ray data collected from multiple angles and mathematically reverses the projection to form an image. The filter is applied to remove blurring, allowing for sharper results, but this method can introduce noise. Then comes the final iteration or iterative reconstruction. It is more advanced approach, starts with an initial guess of the image, then refines it step by step by comparing the guess data for making corrections. This is an entirely computerized process and it takes very few minutes. These algorithms are critical for converting these raw images into the high quality diagnostic images. This is all done by mathematical algorithms which process these images. Hounsfield units is one of the very important concept of CT. These are quantitative scale used in CT to measure the radio density of different tissues. They are named after Sir Godfrey Hounsfield, who is one of the inventors of CT. The Hounsfield scale is a standardized way to interpret CT scan data based on how much radiation is absorbed by different tissues in the body. These are the different Hounsfield scales. Air is considered -1000, bone or metal is +1000, water is 0, and soft tissue is +50, and -100 is fat. So these numbers help us to identify the structure and confirm the diagnosis. Hounsfield units help radiologists differentiate between tissues of varying density, such as bone, air, fat, muscle, fluids. This contrast allows the identification of pathologies such as tumors or if there is a fracture or if there is any foreign body material. Talking about artifacts. So like every other technique, CT has its own artifacts. First is streak artifacts. These are caused by highly attenuating objects like metal implants, fillings, or dense bone. You can see these lines. Second are motion artifacts. Motion artifacts are very common. We see it in our 2D radiography as well. Whenever patient moves, the image is not formed and we see this artifact. Third is the beam hardening. Beam hardening artifact, it occurs when low energy X-rays are absorbed by more higher energy X-rays as they pass through dense material. So whenever there is a very high density bone or metal, this might appear as a beam hardening artifact. This is the ring artifact. A ring artifact looks like a ring here, and this also you can see. It arises from detector or malfunction or whenever there is miscalibration. If one of the detector is not properly calibrated, this may generate a ring artifact. Then comes the metal artifact. It is very common due to dental implants or the crowns that we have, dental restorations. They can lead to metal artifacts. When comparing CT and MRI, tomorrow I will be in this conference, I will also be talking about MRI. So I thought this is very important to understand when to advise patient CT and when to advise MRI. Each has distinct advantages depending upon the clinical need. CT is excellent for detailed images of bones, making it useful for detecting calcified lesions, bone tumors, and fractures. However, it uses ionizing radiation and is less detailed for soft tissues. Advantage again of CT is that it is very faster. It happens in fractions of seconds, and it makes this all less time consuming, makes it ideal for the emergency clinical situations. While MRI, it provides superior soft tissue contrast and detail. It is preferred method for whenever we want to imaging soft tissues such as tumors, soft tissue tumors, or tongue. MRI is the gold standard for tongue. Importantly, MRI does not cause ionizing radiation, so there is no harmful effect on the patient, but it has longer scan times. Patient might have to spend 30 minutes, 40 minutes in the scanner. If patient is claustrophobic, they do not cooperate with MRI. For specific areas like bone and soft tissue, CT excels in bone detail, while MRI is better for soft tissues. Now, CBCT has significantly taken over CT job in dental applications because CBCT has lower radiation dose. It is ideal for dental and maxillofacial imaging in routine cases. Also, CBCT softwares are very much compatible and adapted to our dental needs. Hence, people prefer CBCT. Also, advantage lower radiation dose. It is cheaper. But there are certain advantages of taking conventional CT in cases such as they are more complex cases, such as detailed of bone pathology. If there are any soft tissue evaluation surrounding them, or there are carcinoma patients, and we have to assess the submandibular lymph nodes as well. Whenever there is contrast enhancement required, conventional CT is preferred. Also, in cases of complex facial fractures, CT being bigger might give you advantage. Coming to section 2 is the CT techniques in maxillofacial imaging. Maxillofacial anatomy of the CT is used for the bone structure visualization. CT provides detailed images of facial bones, including mandible, maxilla, zygomatic bone. It is essential for diagnostic fractures and abnormalities. Then sinus assessment, clear imaging of paranasal sinuses, helping in evaluation of sinusitis, sinus tumors, and malignancies involving sinuses. Even anatomical variations can be detected with CT. Then dental imaging, dental visualizing teeth, surrounding structure, implant planning. Previously, it was used for implant planning. Now we all use CBCT. Then soft tissue evaluation displays soft tissues of face, such as muscles and salivary gland, aiding in diagnosis. But still, it really depends which cases you go for CT and which cases you go for MRI. And what are a standard maxillofacial CT protocol? They generally ensure optimal image quality and diagnostic accuracy. First comes patient preparation. It involves proper positioning and instructions to minimize the motion and artifact. We can avoid repeat scan with proper patient instructions. An imaging technique, it includes selecting appropriate methods such as axial or coronal scans based on the clinical need. Scan parameter, now with multiplanar reconstruction, we can see in any plane. Then scan parameters, it involves settings the correct slice thickness, field of view, radiation dose to balance details with patient safety. And then comes post-processing, which includes reconstructing images in multiple planes and using techniques like 3D modeling for comprehensive analysis. Generally, if we adhere to normal CT protocols, we get a best image quality and good diagnostic utility. Now, when we are talking about CT in maxillofacial region, there is one important technique which I wanted to speak about is the puff cheek technique, which is routinely performed. And whenever, if you are advising patient CT scan for the CA of buccal mucosa or the vestibule, it is very important that you tell them that we want puff cheek view, because puff cheek technique is routinely performed in patients with suspected oral cavity cancer. The insufflation of air within the oral vestibule helps in the detection of small buccal mucosal lesions with better delineation of lesion, origin, depth, extent of spread. So for example, here we can see when patient has puffed his cheek, you can see this is the buccal mucosa, this is maxillary gingiva, and this is mandibular gingiva. It all is separated. Now, if you see this image, you can see this is the abnormal mass which was there in this patient's mouth. It seems to be in the upper vestibule here, and here also we can see it. We can see it in the puff cheek view, and then they have given it another image where the puff cheek view was not used, and it is very difficult to differentiate this mass from the maxilla in this case. So if we are advising CT for lesions in the vestibule, make a note that you advise it with puff cheek view. Coming to 3D reconstruction in maxillofacial imaging, it gives benefits of advanced visualization for surgical diagnosis and planning. Many times surgeons appreciate 3D reconstructed images so that they can plan their surgery, and also it is very easy to explain it to patient when they can see the 3D images, and how their deformity will be corrected can be shown it to them on these 3D images. CT angiography or CTA, it is offered non-invasive, excellent angiographic imaging modality for the facial and vascular lesion. So whenever there is hemangioma or other arteriovenous malformation, we can advise 3D CTA with high spatial and temporal resolution. It can enable the excellent lesion detection, characterization, and we can also see the feeding arteries, which is important for the management of these lesions. So if we see here, these are the blood vessels, and they have shown these feeding vessels with arrows. So this is the example of CT angiography. Now, CECT is the contrast enhanced CT. It is a powerful imaging technique that enhances CT scans using contrast agents to better visualize and differentiate internal structures. It also enhances the soft tissue visualization. Most commonly, ion-based contrast agents are used, but others like barium and gadolinium are also used. Barium is mostly used in gastrointestinal imaging. Gadolinium is rarely used. How it really works? By altering the ways X-rays are absorbed, these agents improve the detection of tumors, vascular tissues, and trauma. We have applications in oncology, in cardiology, in trauma. It is very important that we make sure and watch for allergic reaction and monitor kidney function. If the creat level of the patients are not optimal, the contrast agent is contraindicated. Also, these techniques are preferred when you're sure that you can manage the reaction. If allergic reaction comes, there should be preparation for that, because it is very common to have allergy with iodine and other contrast agents. Coming to radiation dose management, it is always our goal to minimize exposure while ensuring the high quality diagnostic images. Techniques like patient positioning, telling patient, giving proper instructions, then collimation, low dose CT scanning, and higher reconstruction models can reduce the dose and improve the image quality. It is important because we know that radiation exposure to long-term radiation can increases cancer risk. Therefore, we must balance patient safety and need for accurate diagnosis. We always follow ALARA principle, which is as low as reasonably achievable, adhere to the reference dose levels, and monitoring radiation dose in real time helps us to follow the protocol whenever it is required. So whenever we expose patient to any dose of radiation, it is important that we follow ALARA principle, advise it only when it is necessary. Do not advise when it can be detected with our 2D X-ray or any other radiation technique where the low dose will be given to the patient. So CT image post-processing. This is again important technique. Here we can improve the image quality after the scan has been taken. Whenever there are softwares with different tools. First is MPR. It is also seen in our CBCT also. MPR is multiplanar reconstruction. So whenever image is generated, we can reformat it into different planes. So one particular image or one particular object can be seen in all the 4 planes. We can see it in coronal, axial, sagittal, and 3D also. It gives better anatomical views. We can also see the proximity of important structures in all the 3 planes and make a perfect diagnosis. Also, surgical planning improves because of multiplanar reconstruction. 3D reconstruction, like we previously said, it is good for patient education. I would not rely much on the whatever see on the 3D because it changes very easily, but it is good for patient education. Then comes the volume rendering. It is a method that displays entire volume data, providing more realistic presentation of the structure. Then windowing is the additional function which CT has, which helps to focus on special tissues. And MAR or the metal reduction artifact, these are also there with CBCT machines. These reduces the streak artifacts. So if patient comes with heavy metal restorations in his mouth with implants or a lot of fillings or many crowns in his mouth, we can apply these algorithms so that we get a better image quality. It reduces these streak artifacts caused by metal objects. Now, all these techniques enhance image quality, provide radiologists with clearer, more accurate data. They improve diagnosis and treatment planning. Now, CT in trauma places. CT scan also has a crucial role when we are talking about trauma in diagnosing, managing facial fractures and other traumatic injuries. Its ability to quickly produce detailed images of bone and soft tissues makes it invaluable in acute trauma situations where the diagnosis is critical. Also, it is very fast, so can be used in emergencies. CT scans help visualize complex fractures, internal bleedings, and other injuries, guiding immediate treatment decision. So again, useful for emergencies. CT imaging can improve trauma care to great extent. Since we get instant diagnosis, immediate treatment can be given. Ultimately, patient outcome is improved. Now, if we see this image, this is the fracture case where anterior maxillary fracture, we can see here. This is the sinus. We can see air-filled sinus, which is generally, this is the normal sinus. And here we can see radiopacity caused because of blood. And here in the coronal plane, we can see the floor of orbital floor is fractured, displaced inferiorly. Again, the blood. in the sinus. CT has essential. They are very essential in oncological managing in oral cancers. CT is useful in every stage of cancer diagnosis. When starting with cancer detection, tumor detection, and staging, CT helps identify tumors, assess their size. They can stage the cancer, whether involvement of lymph node is there or not. We can see it with contrast CT. Now, assessment of local extension, we can see involvement of tumor. If there is any invasion into surrounding tissue, it aids surgical planning. Again, like I said, evaluation of lymph node involvement. CT checks if there is any metastasis to the lymph node and helps in staging again. Now, during and after treatment, again, CT is important. CT monitors after treatment, CT monitors whether there is any residual or recurrent disease remaining. For a certain cancer situation, they do have intraoperative CT and MRI facilities where they take scans during the procedures to confirm with surgeons. While CT provides detailed information, it is always better to use it with combination with other PET or MRI whenever required to get a complete comprehensive assessment of a patient. So we will just have, we have completed 2 sections. So we are in the middle of my presentation. So we'll just take 1 minute break so that you will get time to digest whatever I have spoken, and we will join again. Hello, welcome back. I hope you could just take a break from your screen or relax a bit. And after a very long day of all the lectures.
Yes, ma'am. Please continue, ma'am. Thank you.
So section 3, clinical applications of maxillofacial CT. First, CT in dental implant planning. First, planning. CT provides detailed imaging to precisely plan the placement of dental implants, including bone quality and spatial relationships. CT can give the information about density of the bone, which we do not generally get with CBCT. Now, pre-implant CT scans reveal bone structure density, while post-implant CT scan confirm the correct placement and integration if the implant is properly placed or if it is impinging on some adjacent structure. CT can help us determine that. It enhances accuracy and reduces complications and overall improved implant success and patient outcomes. These days, CT is not that commonly used in dental implant planning. We use CBCT because we have got better customized softwares and we can achieve better outcomes at a significantly lower dose with CBCT. Also, the metal artifacts are also lower in CBCT, better image quality for dental implants. When we take a very small FOV, we get better image quality with CBCT. Coming to sinus diseases diagnosis, CT scans are highly effective in evaluating sinus condition, providing detailed images of both bone and soft tissues. They help diagnose issues such as sinusitis, nasal polyps, or sinus tumors by visualizing blockages, inflammation, and structural abnormalities. For example, in cases of chronic sinusitis, CT can reveal mucosal thickening, fluid accumulation, and any anatomical variants that may be contributing to the condition. Additionally, CT is useful in pre-surgical planning, offering a clear map for sinuses. For procedure, CT cyalography is a specialized technique for visualization salivary glands and their ducts. It involves the injection of contrast material into the salivary ducts, followed by CT scan to obtain detailed image. This method is valuable for diagnosing and assessing salivary gland disorders such as obstruction, stones, tumors. It provides some very high resolution images that help in planning appropriate treatment and intervention. So if we see, this is the 3D image. We can see this is the left parotid gland. You can see bulge over here in 3D. And this is the stone. The same image in the axial section, we can see here the radio opacity laterally. Thus, for a cyalolithiasis or the salivary duct stones, cyalography with CT can help to locate the exact location of these stones and also whether to know whether there is any salivary stone or not. CT can help the diagnosing of this. Now coming to TMJ, again CT imaging is very valuable in assessing temporomandibular joint due to its high resolution capacity and detailed bone structure visualization. It helps in diagnosing TMJ disorders by providing clear images of bone abnormalities, joint spaces, and alignment issues. CT is especially useful for identifying bone abnormalities, joint spaces. It can also help to find the degenerative changes in the TMJ. So if there is any osteoarthritic changes, loss of condylar structure, if there is any notching, CT can help us. So CT is best for the, again, bony structures. If we want to evaluate for soft tissue changes of TMJ, MRI is the gold standard. So depending upon whether we are suspecting soft tissue pathology or hard tissue pathology or bony pathology in TMJ, again we decide whether we want to go for CT or whether we should go for MRI. Here we can see this is the axial section. We can see mandibular condyle, zygomatic process. This is the glenoid fossa. This is sagittal section. Here we can properly see condyle. This is articular eminence, glenoid fossa, and external auditory meatus. We can see all this. We can appreciate this space, joint space. And in cases of osteoarthritis, we see erosive changes here at the end of the condyle. If there are any other pathologies, if there is fracture, we can see it very well in CT. Generally, smaller slice thicknesses are used to evaluate TMJ. Again, CT imaging plays a crucial role in evaluation of cystic lesions and tumors by providing detailed cross-sectional images of soft tissue and surrounding structure. It helps differentiating between benign or malignant lesion, assessing the extent of size of bone, identifying potential metastasis. CT also aids in guiding biopsies and planning surgical intervention by offering a clear view of the lesion's location and characterization. So this is the example of this desmoplastic ameloblastoma in 30-year-old woman. This is the CT scan. You can see this is the mandible. We can see this tumor, which is radiolucent and mixed radioic structures between them. For diagnosing of congenital maxillofacial anomalies. Because of its ability to provide detailed cross-sectional views of complex anatomy, CT helps in identifying and characterizing anomalies such as cleft lip, cleft palate, craniosynostosis, and other skeletal deformities. CT's precision assists in planning surgical intervention, assessing the extent of anomalies, and guiding treatment strategies. Its detailed imaging supports accurate diagnosis and effective management of these conditions. Here we can see this is the cleft in the maxilla. We can see it in CT. This was before bone grafting, and this is 2 months after growth grafting. So thus, for congenital anomalies, we can evaluate patient with CT preoperative and postoperative as well. Talking about pre-surgical planning, it can aid in planning reconstructive and corrective maxillofacial surgeries by providing detailed anatomical visualization. It allows precise surgical intervention. It allows for detailed visualization of anatomy prior to surgery. We can also see if there are any important structures surrounding the pathology, so that safer surgeries can be practiced. It leads to more effective and efficient surgical procedures through better pre-surgical planning. Post-operative evaluation with CT. CT is crucial for post-operative evaluation as it provides detailed insight into surgical site, enabling precise assessment. It helps detecting complications. If there are any post-operative complications such as infection, bleeding, or hardware issues, or integration of implants or graft, whether they are properly integrated or not, we can determine with CT. If there is any secondary complication after the graft placement, if there is infection, CT can help us find out. Also, we can determine whether the location of the implant that we have placed, whether it is correct or it is into the sinus or it is impinging onto inferior nerve canal. CT can give us the exact evaluation. Also, we can determine whether there is any failure of implant, or what is the cause of implant failure with CT post-operative surgery. In case of cancers, the post-operative evaluation with CT helps us if there is any recurrence or the patient is properly healed and there are any post-operative complications. It can be determined by CT. CT imaging is important in maxillofacial region infections. We can see whether there is any spread of infection, if there is any abscess, associated bone destruction. We can see CT gives a very clear picture if we are suspecting any osteomyelitis or the complications due to dental infections. It helps in distinguishing between different types of infection, whether we are suspecting malignancy or osteomyelitis. CT can help us to get an idea about it. See, this is the 2D image where osteomyelitis after tooth extraction. This is contrast enhanced axial CT image. We can see here the ill-defined osteolytic area and also cortical erosion. Here we can see there is breach in the continuity of the cortical plate lingually and buccally. And in 3D, we can visualize again for the patient education. We can see abnormality here. CT is very useful if we are suspecting any space infections in the buccal space or any other spaces. If infection has gone, contrast CT can help us to find that out. For foreign body detection, again, it has superior resolution. So we can determine whether there is any foreign object, diagnose the pathology, why there are problems with the patient. It helps to accurately locate the foreign body objects, assessing its relationship with the surrounding structures. So once we know where the exactly foreign object is, if there are any important structures surrounding it, we can plan the surgical removal for the safer procedures and less complications post-operatively. See here, we can see a foreign body. CT imaging plays a critical role in orthodontics and orthognathic surgery as well. With 3D evaluation, we can help determine the treatment plan and help patient to visualize what will be the preoperative position, what will be intermediate position, and what will be the final position. So here we can see in this image, this is the preoperative position, and transiently, this is how it will appear. And after complete surgical intervention, this is the procedure, this is the position that patient can expect. So this is all 3D generated images for patient education and planning. It helps in assessing the alignment of teeth, relationship between dental arches, the anatomy of the jaw, and it ensures accurate surgical planning for effective post-operative assessment. Coming to the last section, the indications, contraindications, and future trends. CT imaging is indicated in maxillofacial imaging for several key reasons. Trauma evaluation for the identification of bone and dislocations, fractures. CT can show it very well. Coming to infection, detects the extent of infection, abscesses, and associated bony changes, whether there is osteomyelitis or not. A CT can help us determine that. Tumor, like we discussed previously, detailed images of any tumor or cystic masses, whether we are suspecting, depending upon their margin, where there is cortication or it is invasive lesion, whether it is invasive and impinging onto other structures. CT can give this better idea. We can also get to know the staging by determining the size of the lesion, whether other associated lymph nodes are involved. So pre-operative and post-operative, both ways, CT is very crucial in cases of tumors, whether it is benign or whether it is malignant. CT can help us determine it. Now, pre-surgical planning for implant or any pathological intervention. Pre-surgical planning is crucial. CT helps us to get proper guidelines for this planning. And foreign body localization, if there are cases of trauma, cases of accidents, and we are expecting any foreign bodies in sinus or anywhere, CT can help us detect. Now, CT imaging in maxillofacial region has got some contraindication that must be considered. These include is pregnancy. The use of ionizing radiation is generally avoided to prevent potential harm to developing fetus. Then allergy to contrast media. Patients with severe known allergies or adverse reaction to contrast agents may not be suitable for contrast enhanced CT. You can take routine CT in these patients. Renal impairment patient, again, this is again for the contrast media. Patient with significant kidney dysfunction have difficulty clearing contrast agents. It can lead to potential complications. So do not inject any contrast agent if patient's renal function is not proper. For this, generally they take creatinine level, blood creatinine level before injecting any contrast media to the patient. Severe claustrophobia, the confined space of the CT, the gantry, might be scary to few patients. Though this is better than MRI because CT can be done in few fractions of minutes. This is worse in MRI, but still, it should be considered in patients with severe claustrophobia. CT imaging has some limitations. First, radiation exposure. CT gives higher radiation dose as compared to 2D imaging modalities. It involves ionizing radiation. Of course, it increases the risk, especially if repeated scans increase the risk of cancer. Then limited soft tissue detail. When we compare it with MRI, it doesn't give that good picture. It is less effective than MRI for detailed evaluation of soft tissue structures. Then artifacts, if there are metal objects or dental work, if patient has got heavy crowns, we see a lot of artifacts on the CT images. Though we do have metal reduction artifact softwares and these algorithms are improving images these days, but still they have limitations. So if we want to see the finer structure in particular patient and if he is having large crowns or full mouth crowns, it is very difficult to diagnose those lesions or to see those finer structures in patients with heavy metallic restorations. Contrast media risks, potential allergy or adverse reactions from contrast media should be considered when we are thinking of giving contrast agent in patients. Talking about the advancements, AI and machine learning, these are the newer technologies which are transforming CT imaging by enhancing image analysis and interpretation. These technologies improve diagnostic accuracy through advanced algorithms that can detect anomalies on their own without any intervention from a radiologist. They can automate measurements, assisting distinguishing between different types of tissues and abnormalities. AI tools also helps in optimizing scan protocols, reducing scanning times. Additionally, machine learning models can aid in predictive analysis, assessing disease progression and treatment outcomes. So now AI and machine learning are the advancing field they are taking over in radiology. With higher technologies, it will be easier for us to for the computer to make reports. There are softwares which prepare a complete report, and still the humans or the radiologists are gold standard. They can just go through the report prepared by the machine and decide which to keep and what are the areas that the computer has missed out on. So these algorithms and programs are coming up. They will change radiology definitely in future. Now talking about advances in CT technology. CT technology has improved significantly over last many years, imaging capabilities, diagnostic accuracy, even patient safety. And recent innovations include high resolution imaging. Now, modern CT scanners offer increased spatial resolution, allowing for more details and clearer images, which help in early detection and accurate diagnosis. So radiation dose that has reduced in latest CT scans. Faster scanning time, advances in scanner technology have reduced the time required to perform CT scan, which enhances patient comfort and reduces motion artifacts. This is especially more relevant when CT scans are taken for lung, where there are motion artifacts and movement is inevitable. But still, faster scanning techniques are coming up, which are reducing these artifacts. Lower radiation dose, like we said, from single detector to multi-slice CT. Newer CT scanners incorporate advanced dose reduction technology, such as also enhancing with the iterative reconstructive process. So additional algorithms which we apply in post-processing steps of CT scan. Adaptive dose modulation, it reduces the radiation exposure to the patient. Dual energy, this is the newer technique providing enhanced tissue characterization. Now, artificial intelligence integration. Like I said, AI algorithms are increasingly being used to assist in image analysis, automate routine tasks, and improve diagnostic accuracy by detecting subtle abnormalities that may be missed by human eye. So many times, human might miss some of the pathologies or some of the incidental findings. With artificial intelligence, they can help us detect these incidental findings or the other areas which might be missed by human eye. And now, with advancing technology, there are developments in compact CT technology, which can be performed scan in a variety of settings, including bedside or emergency situations. So this is the future. Talking about functional CT imaging. Now, till now, whatever CT imaging we were talking about, it was all structural imaging. So we were dealing with the anatomy and structure. So whenever whatever CT images we have discussed and we were taking, we could see the structure and anatomy. We don't know the function yet. So functional CT is an advanced imaging technique that assesses the physiological and functional aspects of the tissues and organ, in addition to their anatomical details. It evaluates specific functions such as blood flow, tissue metabolism, or organ performance by using specialized protocol and contrast agents. Key technique is perfusion imaging, which measures blood flow within tissues, useful for conditions like tumor or stroke, especially in brain imaging. Then contrast enhanced CT, it analyzes contrast distribution and washout for evaluating tissue perfusion and vascularity. CT angiography, like we said, visualizes blood vessel with high precision, aids in diagnosing vascular diseases. We can find the feeder vessel by CT angiography. We will explore functional imaging in greater detail during our MRI lecture, where we will be talking about functional MRI. So benefits are functional CT are enhanced tissue organ function, improved diagnosis and treatment planning, better characterization of tumors and vascular conditions. So coming to conclusion, CT offers a detailed view of facial structures for accurate diagnosis and treatment, from dental implants to complex fractures. Tools like 3D reconstruction, CT angiography, or advancement in cone beam improve surgical planning, trauma assessment, and tumor detection. CT is crucial for sinus disease, TMJ evaluation, and managing cyst tumors, congenital issues, staging of cancers. It is important to manage radiation safety dose and use safe practice to minimize the risk. Advise CT scan only when it is essential, and it will add to the clinical benefit. Future direction, new technology including enhanced AI will enhance CT's diagnostic capabilities and will expand its use in near future. So takeaway message, CT remains a cornerstone in maxillofacial diagnostics due to its detailed imaging capabilities and wide range of application. Continuous advancements in CT technology and techniques contribute to improved diagnostic accuracy and patient care. And awareness and benefits of limitation of CT is crucial for optimizing its use in clinical practice. So whenever you advise CT, make sure when you advise it when it is essential. You follow all the protocols. See when the CT is needed, when MRI is needed, or it can be done with ultrasound or other 2D imaging. These are the references. Thank you so much for your patient listening. If you have any questions, please ask.
Thank you so much.